Ladies and gentlemen, good morning, good afternoon, good evening, depending on where you are. I'd like to say thank you to everyone who has had an input in this conference in whatever way possible. I want to start, first of all, by discussing the earlier interaction that I had with the European Hematology Association and the British Society of Hematology following 2019 ASCAT conference. I was approached for us to have a joint conference. And the reason was the British Society of Hematology was celebrating the 60th anniversary. And EHA was going to start their first European Sickle Cell Conference. This discussion went very active. And by December, we had produced this flyer showing that we intended to run the conference between the 29th and 31st of October 2020. And following this advertisement, we went ahead to source the venue and agreed to do this at the Park Plaza, Westminster Bridge, London, and had 2 floors to make sure that we accommodate the increased number of delegates as a result of this joint effort. We then set up a steering committee, and this steering committee, we had NICA, Professor Maria Capellini, representing EHA, and Dr. Subhana Chakravarti, board member of the British Society of Hematology. And then we have Professor David Rees from King's College Hospital, London, Alita American University of Beirut, Rachel Kese Adu from Ghana St. Thomas's, London, Bri Annie Maria, the then Chief Medical Officer for the Sickle Cell Disease Association and also adult hematologist, and Dr. Andrew Campbell of the Children's National Washington, Professor Marsha Treadwell, who had been in the steering committee and a professor of psychiatry, and Dr. Raffaella Colombati from Italy, who had also been on the steering committee. And we therefore had clear responsibilities and what to lead. Thalassaemia was led by Ali and Nika. Basic science and emerging therapies, David and Andrew, and psychology and patient-related outcome was led by Marsha, and also to co-opt other members to work with her. Adult sickle cell disease was done by Bri and Rachel, and the patient forum was led by Rafaela and Subhana, and the global agenda was contributed to by all the different members. COVID-19 happened, and we had to consider the next steps. And among the options were either to proceed or to cancel, or to do a hybrid or a fully virtual. And I had the romantic idea that by September or October, we would expected that COVID infection would probably be under control, and we'll be able to have a hybrid with those who live in the United Kingdom and Europe to participate face-to-face, and the rest of the world to join. The story obviously had turned out to be very different. And then we learned from the European Hematology Association, who did a full virtual conference. And together with the British Society of Hematology, we then approached MCI and then went to work for a full virtual conference, and then established communication through Slack platform and lots of meetings through Teams, Zoom, and also communication through Twitter to raise awareness of what we're doing. And these are some of the examples of our advertisement prior to this conference. I must say thank you to my team. Obviously, there are much wider number of people who are working on this, but Steph is my staff that has worked with me for a number of years. And Amara is my daughter, who has decided to join us and to support us in this work. And one of our colleagues, Kaluba Olga was responsible for the designs and continues to be supporting us in all of this effort to make sure the conference um, really meets the expectation of the high standard that we are all agreed to establish. I also wish to say thank you to our sponsors. These sponsors have made it possible for us to have fully paid off delegates that were funded by them, and also provide the support that we're able to undertake the design and the work plan that was going to meet the standard that you have experienced throughout the week. And to cap it, uh, because working with the European Hematology Association, we were able to produce the first book of abstract. And this book of abstract, I would recommend that you kindly take time and go through the material that's in it because it is of high quality. And I want to thank the steering committee and in addition, Jaylene Porter and Miguel Abud for their commitment and their support in selecting the abstracts that meet all the expectation. And I recommend this for your reading. I want to thank all the speakers. Some of you were so busy that you really squeeze out time to present. And I could see that some of you are really struggling with various options in terms of the time of speaking and actually to try and be able to take questions. And some of you were able to present even at very difficult situations. I also want to thank the delegates who came across from all parts of the globe. And as this heat map would show, we have people from the US, from South America, from Africa, from India, from Indonesia. And as you could see, these are example of the countries that participate in this conference. And I want to say it's been very good and it's been very reassuring. I also like you to take some times over the next months to go through the ASCAT on demand. This would have all the sessions that were recorded, and you also have additional material by clicking into the lobby. You'll be able to make your selection by going to the posters. You can download the book of abstract and also go through the posters, and most of the presenters actually recorded messages for us so we could review all of those information. And also in the ASCAT on demand, you'll find more information about the British Society of Hematology, the European Hematology Association, and ASCAT and how this was founded. Going through the exhibit hall, you would go through to our sponsors and also collaborators who have their material there for you to view. That includes even our national hemoglobinopathy panel, which is the England service for sickle cell and thalassaemia, and information about the coordinating centers and the specialist treatment centers. And all of this will be there. And I would encourage you to kindly go through and actually observe them. I do not intend to review the conference because that would take me a number of days to do so. But I just wanted to show this slide, which Professor Peel presented to us, and talking about the need for evidence-based data to support national plans. How do we define the burden of disease? And that includes both sickle cell disease and thalassemia. And how do we support the integration of newborn screening, early intervention, and to strengthen referral pathways to make sure that those who have been diagnosed receive comprehensive care that is commensurate to the finances or the personnel that's available to ensure that preventive prophylactic therapy, hydroxyurea for sickle cell disease, blood transfusions for both disorders, and the treatment of various complications. And looking at the evidence that we have, for example, for sickle cell disease, that this has been increasing. It has been encouraging. However, if you compare this with a comparable condition such as cystic fibrosis, the publication of cystic fibrosis is way above, and we'll have a lot of room to catch up. I also showed this slide presented by Admiral Brett Giro, the Assistant Secretary of Health for the US, who is so passionate about sickle cell disease and highlighted the collaborations that actually exist in addition to others that actually they may not be included here, and working together towards an effort that will actually lead to successful dealing with sickle cell disease and similarly with thalassemia. And coming back towards Africa, there are a number of networks that are also coming up in Africa. And the challenge here is to work collaboratively together in order to ensure that all of these services would lead to significant impact in the continent, and similarly in South America, in the US, and North America. And across the globe, there are so many initiatives. One of the challenges is how to bring this together to lead to a joint effort and good outcomes that actually would benefit everyone and actually would lead to significant impact. I want to summarize some of the significant impact that we could do, particularly with the data that we have collected and analyzed. This was done by one of the ARISE fellows, Dr. Moses Mumman, and it was presented as part of the oral abstract by Mrs. Bola Ojo, which showed that in Kaduna State, with a population of over 8 million, and using the prevalence of sickle cell disease of 1.2%, the proportion of patients that are currently registered in sickle cell clinic in the public health hospitals is far less than what is expected. And if this is Kaduna State in the central part of Nigeria, and this is if you're looking at this map, it shows you in the green map with the dark areas as areas where there are teaching hospitals. And looking at this across the state, the yellow orange area is actually showing the number of patients that have been registered in public health hospitals. But the blue area shows that actually nobody knows whether these patients are registered or whether people know about them. So there's still a gap between those who have been registered and those who may not be registered. We did have a limitation whereby the private hospitals were not included. But despite that, looking at the majority of health provision, we actually do not yet know how many patients are registered. So these are examples that we can make significant contribution to by very little effort. I want to say thank you really for your participation. I want to encourage collaborations. I want to encourage us working together. And I must say, in view of COVID, I will recommend that we stay safe and please mask up for cell disease and thalassemia. Thank you very much. Safe back to your places if you are not at home, and do have a good rest over the weekend. Thank you. Bye.